retired in the state of Louisiana. I was the Deputy Assistant Secretary in charge of the Bureau of Policy Research and Health Systems Analysis. And I have read the ACA from front to back as part of my job, and I also read HR 1628, the AHCA. And the Republican Party has talked a lot about patient-centered care, that devolving decision-making to the states and to the patient and their doctor. In 1628, there was nothing said about patient-centered care. There was also nothing said about uninsured. And what exactly do you mean by patient-centered care? And my question to you would be, how do you ensure patient-centered care to people without coverage?
Yay! Yeah, right.
If everybody's going to be guaranteed patient-centered care, how would you pay for that for uninsured people, and who would pay for that? Please don't tell me that you'll use the disproportionate share hospital program, because that is only for hospitals. A small portion of hospitals really get the money. They only get a fraction of what their uncompensated costs were. It's not a patient-centered care program. It's after the fact, cost statements by the hospital, no medical records are involved. So if that's the only program you have, then you really have nothing. The issue of insurance being sold across state lines, that would essentially take power away from the states and would make it less possible for state insurance commissions to prevent bad policies being sold in states. Would you create a whole new federal bureaucracy to oversee that? What agencies would you invest with the power to oversee these insurance policies? Because insurance fraud in the healthcare industry is a big problem.
Yeah.
To me, patient-centered care, patient-focused care is a physician and a patient making decisions and not bureaucrats in Washington.
That's what we have now.
Yeah, that's healthcare.
That's healthcare. That's
Who pays for the uninsured then?
HR 676.
Okay.
My doctor doesn't even talk about it.
Questions in there. I'm going to there's going to be 4 or 5 questions about healthcare. I appreciate your statements. I don't necessarily agree with some of them, but thank you. Let's let someone else talk. Let's let someone else
I see
talk.
very little content. If you need help with content and substance, I'll be glad to help.